So vomiting is a very common symptoms with children and babies. They vomit for any reasons. And the most common cause of vomiting is your common cold, cough, runny nose, things like that can cause the child to vomit. And also high fever can cause them to vomit. So you need to identify whether that's the cause. And if the child is persistently vomiting for a certain period of time in a day, it's best to take your child to see a doctor before the child gets dehydrated. The other conditions that can cause vomiting, that's more related to the surgical cause. What we are looking out for, if there's any significant pain in the abdomen or in the groin, testicular problem, or even obstruction to the intestine can cause the child to vomit. The quality of the vomit is also different with an obstruction versus somebody who's got a common cold or cough. And somebody who's had persistent cough with the abdominal symptoms, abdominal distension or abdominal pain is more surgically related. So once you see a doctor or GP for this, the GP would then refer your child to a pediatric surgeon. The commoner cause for a bowel-related problem, as you know, the bowel extends from the mouth right down to the bottom. Anywhere along the way where there's obstruction or disruption to the intestinal flow can cause the child to vomit. The common surgical causes for a child to vomit is something like appendicitis, where there's inflammation to the intestine, which causes the intestine not to function normally, and therefore the child can vomit. The other more complex conditions where the child is born with a blockage to the intestine, such as the Oesophageal Atresia, where there is a blockage to the esophagus, anywhere in the small intestine or the large intestine, or absence of a bottom, something called Anorectal Malformation, can cause the child to vomit as well, where the child has a distended abdomen, not passing flatus or opening his or her bowel, and starting to vomit. And these kind of vomits are often something called bilious vomiting, where the vomit is greenish in color. So when we see a child who's vomiting or who has a surgical condition, first we need to assess the child, see what the problem is. We may need a few scans, an x-ray, a further examination. If it's a newborn, then we often have an idea of what kind of obstruction the child may have, and then go on to have surgical intervention if required. If there's an atresia where there's blind ending bowel, which is not connected to the intestine further downstream, then we need to reconnect that. If the child has something called a Hirschsprung's disease, where there's no nerves to the bowel at the bottom end, then the child may not necessarily need surgery at that time, but parents may be taught how to evacuate the child's feces by washout and make the child able to pass flatus and feces for a certain period of time, before which the surgery is conducted a few months down the line. A child who has got no visible anus will require something called a stoma, so that the child will be able to pass wind and also open his bowels to the stoma. So most of these surgeries I'll perform by the keyhole method, where you introduce a small camera into the tummy or the chest, and then a few other small instruments to repair and perform the surgery inside the abdomen or chest. Almost all surgeries are now done by the keyhole method, so that there's minimal pain and faster recovery for the child.